This is Jinju, and I'm going to share to you about blood specimen collection based on our notes. So what I'll be doing is I'll be reading the textbook and be summarizing important things that someone has to understand and learn for their examinations and for practical things. Okay, so this afternoon, in my time, this afternoon, we'll be discussing blood specimen collection, chapter 3 of hematology. Before that, the book that I'm using is Rodaks Hematology, Clinical Principles and Applications, 5th edition. So if you got more other editions, like the 6th or 7th, you may use that as well. Now, we will be proceeding to chapter 3, because I believe that other chapters can be discussed in other subjects. Now we'll do blood specimen collection. So blood specimen collection is an important topic because it is the foundation, not really foundation, but everything's important, but this is important especially when we are collecting blood. Since we are talking about hematology, which is more on blood, basically we will be learning on how do we collect the blood. The title of a topic, and we have the objectives in the outline. So this is how we will know what are the things, objectives, yes, and the case studies. Okay, so first of all, I'll be discussing about the objectives. So we'll be learning them one by one based on these outline. And you can get your notebook or anything that is in your hand so we could summarize the book efficiently. Okay. The first objectives we'll be learning is describe the application of standard precautions to collection of blood specimens. Okay, let's just take it one by one. Alright, and then we have the collection equipments, the list of equipments, tuber stopper color, and type for laboratory test. Select certain veins and name of the veins of choice. Steps for order of draw for tubes. Complications. Steps for skin puncture. Components of quality assurance. And specimen collection. Specimen rejection. That is also important. And then the acceptability of the specimen, deviations, most important step in phlebotomy procedure, list reasons for inability to obtain a blood specimen, and legal issues. So these are all practical, and you may have to use this knowledge to become your common sense. Now we have these case studies in which after we will be reading and breaking down the topics, we can answer these case studies, which is number 1 and 2, as you can see in the screen. Okay, so we will just get back to this after. Now, before we proceed to the first chapter, let me share phlebotomy is meaning to cut veins. Yeah. The process where you collect blood, collection of blood. Phlebotomist is someone who collects blood. So they can be certified to be a phlebotomist in a hospital. Yeah. Now in the Philippines setting, the medical technologist can also be a phlebotomist. They can collect blood as well. Okay, so let's go to our safety. Now, as I've mentioned a while ago, blood specimen collection is more on using practical knowledge to common sense. The first thing we have to know, or the first thing you have to learn, is our safety. Now, why is safety important? Of course, we are in the hospital, and we should remember that the standard precautions is all specimens must be treated as potentially infectious for bloodborne pathogens. Now, this is a key takeaway. This is a key takeaway for all of us. Number one, all specimens must be treated as infectious. So basically, no specimen is safe. You have to assume that everything is infectious. Also, we have to protect healthcare workers from exposure to bloodborne pathogens. So these are the common bloodborne pathogens. Now here, bloodborne pathogens are, to name a few examples from the book, is the hepatitis C, hepatitis B, hepatitis D, syphilis, and malaria. Lastly, we have the HIV. Now, how do bloodborne pathogens enter into the body? We, of course, since we are dealing with blood, and in order to get blood, we need to use needles to puncture our body. Then, we might get them through accidental injury. Therefore, the phlebotomist or whoever works in the hospital dealing with collection of blood must be careful in collecting them. Like here in the book, it says sharp object, contaminated needle, scalpel, broken glass, or any object that can pierce the skin. Cut skin areas or dermatitis or abrasions and may also provide a portal of entry. Indirect transmission, yes, here you go, can occur when a person touches a contaminated surface or object when touches the mouth, eyes. And then hepatitis B, standard for at least 1 week. Now, because of these things, now we know that potentially you may get sickness, bloodborne pathogens. Therefore, there are 2 ways. That's why here in the next topic, the book is explaining to us what are the things that we should do to protect ourselves. How? Now, in order to protect ourselves, there is the hand washing, as mentioned in the book. Hand washing, which is the most important practice to prevent the spread of infection. Now, ideally, the phlebotomist should wash our hands with soap and running water between patients, and every time gloves are removed. Okay? Alcohol-based rub may be used if not visibly contaminated. So if your hands are bloody, then of course you need to wash your hands. And next, we use the gloves. Gloves are in white gloves because of what the book mentioned a while ago. Contaminated surface or object, and then when we touch the eyes or mouth, of course, we become sick. Gloves are removed. No blood from soiled gloves should come in contact with the hands. Next, we need to know where do we have to dispose our syringes or needles after use. We know that they are all disposables. We need to put them in a punctured or puncture resistant container with red or red-orange biohazard sign. Okay. And of course, for our safety, we need to know and remember that hand washing, gloves is very, very important. So these are the 2 things that is the thing that you have to remember, especially working in the lab. Not only in the hospital setting, but as long as you're in the lab. Now, a phlebotomy should be responsible with the infection control since we have this chain of infection. And the only way to block it is through what? Through hand washing. through hand washing. Very important. And a phlebotomist must maintain good personal health. Oops, so big. Health, clean, and special attention to use of gloves and hand washing. Okay, so that is for the first part of this introduction. Now, to proceed, we have the physiologic factors affecting test results. Okay, so physiologic factors. A phlebotomist must know these factors because they are special timing and positions where the test results may vary with the clinical diagnosis. So here are some, not everything, that can contribute to pre-analytical variations in results. There is the posture, diurnal rhythm, exercise, stress, diet, and smoking. So posture, protein, cholesterol will differ with the values. Diurnal rhythm, like there are some hormones that are high in the morning and some are high in the evening, especially cortisol, TSH, and iron. Exercise, person who keeps exercising will have like high creatinine, total creatine kinase, myoglobin, and white blood cell count, etc. Stress, yes, especially through excessive crying children and anxiety, they have increased WBC count. Diet, this is usually for glucose tests like fasting blood glucose, random. This is very much important. And smoking. Okay, so those are just examples for pre-analytical variations in test results. All right, so these are the things that a phlebotomist must be aware of whenever she goes to work. Yes, so the timing, safety, good hygiene. Okay. Quiz time. You may pause the video to answer the questions.